who's in charge. And then we have Huda Sharaf, our star, who's in charge of Pat Walker Medical. And so we have this panel, we have pre-submitted questions, audience questions. I've been told that last time there was a desire for more audience questions. And so we're going to make sure that the audience has ample opportunity to raise questions. And then, of course, feel free to submit questions, and we'll try to get through as many as we can in the hour that has been allotted for us here. Okay, let's go ahead and get it started. And I guess we should start with Huda with kind of a general update as to the our COVID conditions here in Northwest Arkansas. What are we dealing with at this moment?
All right, so I think as most people may have read already in the newspapers this morning, is that we had a substantial increase in cases. Actually, over the weekend, 3,000 more cases were added. Unfortunately, several more deaths as well. The cases and deaths in our state continue to escalate. You know, the good news is that more people are going forward and getting vaccinated, but again, it's pretty slow. I mean, as a state, our fully vaccinated percentage right now sits at about maybe 40%. It had been 37% about a week or so ago. So again, we're making progress, but there's still a lot more progress to be made. Like I said last time, the Delta variant is very different than the original COVID-19 strain in the fact that it is much more contagious and much more dangerous in the fact that it can actually duplicate and replicate itself 1,200 times faster than the original COVID-19 strain. And we all know how much havoc and destruction the original strain caused. Good news is that the vaccines, all three of them, are still over 99% effective in preventing significant disease, which requires hospitalization and obviously preventing death. The bulk and the majority of the people being hospitalized and dying are those that are unvaccinated. So I cannot stress that point enough. Last time we met, our healthcare resources in our communities were already being strained. Last week, we met with another challenge. In the state of Arkansas, we have a total typically of about 1,200 ICU beds across our state. Last week, there was one ICU bed available in Southern Arkansas. The rest of those beds were being filled by not only people that unvaccinated people with COVID-19 infections and complications, but also people who have delayed their own care for a year and a half because of this ongoing pandemic. So you have people with diabetes, high blood pressure, other chronic medical illnesses that did not seek out care and now are showing up into the emergency rooms in crisis. The question that I get a lot is, well, so if I get COVID-19, then I'm going to get hospitalized and maybe I'll find a bed. I said, no, that could very well happen, yes, if you're unvaccinated. But the bigger picture here is that if we get in a car accident, if our children might get in a car accident and they require hospital admission, there are no beds. And people are like, well, you know, Washington Regional has all these hundreds of beds, but they said they only have so many patients in the hospital. Well, you need nurses and you need physicians and you need medical staff. So they're short on them. So they're full, and all of our hospitals are. So the one way to protect yourself, obviously, is to be fully vaccinated. Even if you've had COVID-19 in the past, again, that natural immunity only lasts about 90 days. The immunity from the vaccine lasts at least 6 to 9 months at this point. And we're constantly looking at titers of people who've been fully vaccinated. It offers protection. And so that's the message that I'll constantly be saying. So that's how it is. You know, I feel like, you know, I don't want to necessarily scare everybody that's on this meeting, but that's the reality that we are facing. And the states around us are all having the same problems. They're reaching out to us for help, and we're reaching out to others for help, but everybody is short. So.
Thank you, Huda. Last week, we were informed from a board meeting and resolution that we had the power to institute a mask mandate for our campus buildings, which we did quite readily after receiving that resolution, and we're very thankful for that. Terry, How long do we plan to keep it? Because that's a question that students are asking.
Just when we've said all along, we will look at the conditions as they continue. Hopefully, this will get improved as the semester goes on. But right now, we will just, it's in place until further notice because, but we will look at all the conditions as it progresses through the fall semester. As to whether later in the semester, will it still be warranted? That just depends upon what the pandemic, how it progresses or changes as we go forward.
Thank you, Terry. Melissa, what happens if a student refuses to abide by the mask mandate that we've enacted for the campus buildings? What should faculty do?
Students are required to comply with any directive given by a university official, and that includes course instructors. So if a student is not masked in a classroom, as is required by our current directive, which states if indoors, not socially distanced, a mask is required. That student should be asked to comply, give every effort to encourage that student to comply. But if that student does not comply, that student should be reported to the university conduct office. And rather than make a phone call or email, instructors should use report@uark.edu. Give the student's name, give the course's name, the instructor should give that name. And the conduct office will work with that student, hopefully through an educational conversation so they understand the importance of complying. Students who are perpetually non-compliant will receive more strenuous consequences.
Thank you, Melissa. I promised the audience that we would open the floor for questions, and I mean to keep that promise. Let's open it now. Questions from the audience? See a couple of hands. Let's start here and then we'll come to you, Tim. Yes.
I'm one of the students who signed up later in the year for university housing, and we got moved into apartments that are off campus. I was very curious about how the bus shuttles will be for those campuses, because I looked on the apps and I looked around, but the closest bus stops to my area is a good amount of a walk away from where I actually am staying. So are they getting updated? Are new bus stops being put down?
Melissa, are you familiar with the plans for university housing, or Scott, with I know that's not exactly your area, but you're in that division. Any updates on the bus routes and how we plan to accommodate students? And
I do not, Chancellor, but I'll make a note to find that out.
we will get you an answer and make sure that if you'll send me an email directly, cfrobbins@uark.edu, make sure you get an answer to that, because it's a really good question. We need to make sure that we provide you with the appropriate transportation from your apartments to the university.
Thank you.
Very good question. Yes, Tim.
So in my syllabus, which I haven't sent out yet because things keep changing, I say that face masks are required in the classroom. If a student in my classroom finds a place, a seat in the classroom that is 6 feet away from every other person, and they don't want to wear a mask, and they say, well, I'm just following the rules, what's my response?
I'm happy to respond to that. We have designated that classrooms are spaces where the mask is required, regardless of the actual ability to socially distance, because again, of the proximity of most students to one another. So the mask is required in the classroom. And so that's how I would respond to the student, because again, that may be a situation where that's possible theoretically, but in most cases, that's not possible. And so rather than cherry picking that, we're saying in essence, that's a space where masks are required.
Thank you. That's good to hear. And one follow-up, I don't remember or if things have changed. Are face shields alone? Okay, Huda says no.
Now, we keep getting this question, Tim, about face shields. Again, I will reiterate, face shields are not to be used in substitution for a mask. They can be used in addition to a mask if someone wants to wear a face shield, but it is not in lieu of a mask.
Thank you.
Yes, sir.
That's a question on behalf of the international faculty. It's important for us, and I think it's for all faculty, not to wear face masks if they are maintaining 6 feet distance, because students can read your lips. But for international faculty with accent, this is even more important. If I can make sure that there is a 6 feet distance between the podium and the first student sitting in front of me, can I take my mask off?
What I'll say is this, there's more than just the two of you in the classroom, correct? And so it's a comfort level for the other people in the classroom. And again, the guideline is if you're unvaccinated, prior to all of this, Act 1002 and all of this, if you're unvaccinated, you're required to wear a mask. So you're not going to know in your classroom who's fully vaccinated and who's unvaccinated. So I would lean towards the fact of keeping the mask on, ensuring a safe space for everyone in the classroom. And I understand with international students, I understand that in the reading of the lips, and I know the language barrier. There are things that could be considered. I don't know how well the clear masks work or how they filter things, but I know that some speech therapists are using that so they can actually see the lips moving, but I would not recommend that. And then the other thing too with classes is that, sometimes faculty will walk around the classroom and students may congregate in certain areas of the classroom prior to the class starting. And it's something that we would not be able to ensure was consistent 100% of the time. And it's a very small ask to have people wear a mask. I mean, it is a very small ask.
And I want to echo that. I think if we start making allowances, then there will be allowances. And of course, if there's a medical allowance that, we have to consider, that's different. I think otherwise we want to be as consistent with, requiring the mask as possible. I mean, have we considered masks that are, clear, that allow some ability to see lips? I don't know if that's possible, but something that allows us to be better to see the lips so that you could have an opportunity to deal with the language issue. Terry?
I was gonna say, we talked about recording. I know we have said that it's not required to record your class, but a recording is a very good tool for students to be able to go back and listen to pieces of a lecture many times. So I would encourage you to record your class if possible. But as we said, it's not required of you to record it, but that is a good tool to help students that may not catch it the first time, but may be able to go back and listen to that recording. So it's a tool for you to consider, to think about using.
Thank you.
As a kind of follow-up, will there be hand mics in each of the classrooms that we could put closer to our mouths so that would help to facilitate what people hear?
It's a good question. Scott, can you talk about the updates in our equipment that we've made in many of our classrooms?
So we have the three primary things: wipes, sanitizer, and mask. We have a good supply of both disposable masks and cloth masks at facilities management, and those are available to the campus as you need them at no cost. Those were provided through the CARES Act. We have hand sanitizer and we have wipes. We can deploy those to the classroom if that's what's needed. I don't know if we have enough of those for every classroom, but that's something we can absolutely pursue. So that's mics.
What are the mics?
Mics. I heard wipes. I heard wipes.
See, that's
Yeah, go ahead, Terry.
I was gonna say, in this room, you can see the two mics. There's two microphones, they're array mics. They actually, they told us and cautioned us to caution their class. If you're sitting in the back of the room or in this room and you're having a conversation between you and the person next to you, that mic is going to pick it up. So we have invested significantly in an upgrade of the microphones that will capture the faculty members talking as they're moving around. And this is, and there's some tests, and they showed this last, Catherine Zawoski in IT showed us some examples of what it actually does. So we're trying to make it where the faculty can walk in, not have to wear the mics, but that will capture it. And I think with the new technology, that has gone a long ways to do that.
Thank you, Terry. Following up on the mask mistake, which was important though, Scott, there's a question that's been sent in about the availability of masks to individual classrooms. Will we distribute those masks kind of routinely to classrooms, or does there need to be a request for masks?
I think we can make them available in the classroom, that we have plenty.
Sure.
So we can put boxes in the classrooms and then have custodial keep an eye on those and replace them as necessary. Certainly if you're with a living group or some other special circumstance and you want to come get a bulk set, you can do that at facilities management.
Okay, great. Yes, sir.
Students who ask to be allowed to be remote, what kinds of reasons do we have to agree to in the eyes of the administration?
Terry, feel free. I'm happy to answer, but I'll try to restrain myself on that one. Go right ahead.
We are primarily face-to-face, in-person campus for the class delivery. That's what our students have told us they want. That's where we're at. You are wanting, and I say, to be able to teach remotely. I use that word as a terminology we came up with. Is really an online synchronous class is what you're talking about. But you will have to go through the office of OEOC to be able to document the disability as to what you're needed to be able to, the reason you cannot teach in the class, and we'll look at the accommodation. We'll see what we can do.
I'm not asking about the instructor, the student who says, I want to be remote, I don't want to come to your classroom. What do you expect us to tell the student?
Okay, I sent out some things last week through your deans about the faculty controlled class attendance. And I gave some examples of how, and we did ask the faculty to consider being lenient because we don't want students coming to class sick. And so the faculty can offer, they don't have to record, but if they're going to allow a student, and it's their choice as the faculty whether they accommodate students this way. They can say, yes, you can attend my class. I will provide you with the class recording. You can also turn on the synchronous, the Zoom if you want to for those students. But a faculty controls their class attendance just like before the pandemic. Whatever you want, if you wanted to, some faculty never checked attendance. Other faculty were very rigorous and difficult, attendance every day, no matter what. We just ask you to be considered to be lenient this semester in the pandemic and try to accommodate the students where they're at with their issues.
I'd like to underscore that these classes that are currently face-to-face are expected to be delivered face-to-face, so that if you allow a student based on request to go remote, that's within the faculty's power to do, but the faculty member is expected to teach from that classroom, so that if the student changes his or her mind at moment's notice without any type of notice to the faculty member, that student can return to the classroom and find that there is a class there taking place at the prescribed time and date. So it is really, if the faculty chooses to accommodate student requests, the class doesn't go remote. The class is still face-to-face by every definition of it. It is simply an accommodation of the request of that student. Steve.
Terry, for point of being complete, you're also asking though for the faculty to retain a written record from the student that wants to go remote, so that we have a record of the choice of that student to go remote. Is that correct?
That's correct. This is something we're asking the faculty to do, is to keep an email trail of that, to where they say, we're accommodating your request to attend this class remotely, not attend a face-to-face lecture, but to attend it, either remotely or get a class recording. But we're asking you to keep a record of that where the student has asked you to do that.
Huda, a question came in, what percentage of our campus is vaccinated? Do we have the latest?
We don't have the information yet. There was a list of Arkansas resident students as well as faculty and staff sent to the Arkansas Department of Health, so they would cross-reference with the state's database of those that have been immunized. And we're still waiting to hear from the Arkansas Department of Health of what those percentages are. So hopefully we keep reaching out, and I know that they're doing this for all of the institutes of higher ed in our state. So hopefully we'll get that information soon.
And for the record, the administration is not sitting on this data, unwilling to share it, because it reflects something that's not positive. We don't have it.
No.
If we had it, we would share it, just so if there's a conspiracy theorist among us, I just want you to know we do not have that information. So sorry to disappoint. Yes.
Yes, while we're on the subject of vaccinations, you said that the three vaccines that have been used so far have proven to be effective 6 to 9 months. And then what happens? Some of us got ours right away, right? So we're reaching.
No, I know. I was vaccinated in January. So I know.
So what happens is the university say, I know you can't predict what's going to happen with science and when there's a booster out, but will there be an opportunity for us who are expiring soon in terms of the vaccine? That's what you say. Will there be an opportunity for us to get the booster here?
Yeah, so that's actually a very good and timely question. So as of Friday, the CDC released official recommendations recommending a third booster for those who completed Pfizer and Moderna, for those who are significantly immunocompromised. So that basically means if someone has an underlying medical condition that renders their immune system very weak or almost non-existent, let's say someone who has cancer, who's currently undergoing chemotherapy, or someone who is status post an organ transplant that takes medicine lifelong to basically dampen their immune system, or people who take medications for other reasons that dampen their immune system. So the CDC just released, the ACIP met the morning of Friday. They released the recommendations Friday afternoon. Now, Pat Walker is in the process of coming up with a protocol and procedure. Obviously, if we serve as a primary care physician for someone who calls, it's pretty easy because you know that patient. But if we have people from the community that are calling us and requesting that third booster, we have to have some type of an idea of how they qualify. So that was released on Friday. The next group that they will be looking at is the elderly and trying to make a determination on whether elderly will need to get that third booster. And then so on. They're basically, again, it's that rigorous scientific data-based review of the information that determines and drives their decisions. The issue that we have right now is that there was not an announcement made Friday about Janssen. It was only about those who are fully vaccinated with Pfizer and Moderna, the mRNA vaccines, and that booster shot. So Janssen is a question we get a lot in our clinic, and there still hasn't been any recommendations yet for a booster with Janssen. So more information to come for sure. We're already trying to stockpile some vaccines, kind of predicting, hopeful that students will come to campus and want to start vaccination. Very helpful for that. And then the other thing is also looking towards that booster need for campus as well. So yeah, very timely question.
Bill, the questions come in, why don't we require vaccinations?
So there was a piece of legislation that was enacted
by the Arkansas General Assembly in the most recent legislative session that prohibits public entities from requiring vaccinations as a condition to participate in employment or education or other kinds of benefits. And that legislation is in effect. And based on that, the university and other institutions of higher education, K through 12, public K through 12 schools and others are prohibited from requiring vaccination. We can strongly encourage vaccination, but we have to make it clear that it's not mandatory. We can offer incentives, and so that's what we've done. I'm really pleased that we've now launched this effort with a lot of really appealing incentives for our students to encourage them to get vaccinated. And they can enter into a drawing, a weekly drawing that's got all kinds of great opportunities, including some tuition discounts and football tickets and performance tickets and parking discounts and a bunch of other things. And hopefully that will encourage a lot of our students who might not have gotten vaccinated at this point to consider getting vaccinated and participate in that. But that's the reason that we can't require that at this point in time. There was also a provision that prohibited us from requiring masks, but that provision is the subject of an injunction by a court that was issued recently that enjoins or prohibits the enforcement of that requirement. So that's the reason that our board of trustees was able to put in place a requirement that we require masks under the current conditions. So we have to approach those things a little bit differently because the provision about vaccinations is still in place and effective.
As a student, what would be my responsibility if I am exposed to COVID? Aside from the quarantine, do I have to email my teachers? And is there anything that I have to do different since I'm vaccinated versus unvaccinated? Or
Good question, Melissa.
The first thing that anyone on our campus should do if they test positive is report via our COVID self-reporting site. If you feel like you have been exposed to COVID, I'm going to let Huda give you instructions on what to do after that.
So if you are identified as a contact, so you've been in close proximity with a COVID positive or presented person, if you are fully vaccinated, that means it's been at least 14 days since your second dose of Pfizer or Moderna, or 14 days from your single only dose of J&J Janssen, they're all the same. And you're fully vaccinated and you have no symptoms, you do not need to quarantine. All right. Now, if you begin to develop symptoms, well, then you do need to quarantine. And the other thing too, with fully vaccinated contacts, no need to quarantine if you have no symptoms. You should go ahead and test about 3 to 5 days post-exposure, because we are finding that some breakthrough infections are happening even with people that don't really have any symptoms. So that's just a safety net. Now, if you are an unvaccinated contact, you must quarantine immediately for 14 days and test 3 to 5 days post-exposure earlier if you develop any symptoms. So again, there's a carrot there. If you're fully vaccinated contact with no symptoms, you do not need to quarantine. And so that's a 2-week section in your life you don't necessarily have to miss out on unless you start developing symptoms or test positive for COVID.
Thank you. Lisa.
And just
Go
quickly,
ahead.
back to your question about notifying your instructors. Our policy is that a student who is not incapacitated should reach out to his or her instructors and tell them of their situation, positive test, need to quarantine, need to isolate. An individual who is incapacitated, have a parent, have a roommate call the Dean of Students Office or report at uark.edu. And the Dean of Students Office and UA Cares will assist that student in notifying instructors and accessing any other assistance that they need.
And students can receive both a COVID test and vaccination on our campus. That's correct?
Yes.
That was one of the questions that came in over virtually. Lisa had a question from a staff member about children in public schools who may have to undergo quarantine. What does a staff member do in a case where they may have to be away with children who are quarantining at home?
Sure. We did find out last week, and we were so pleased that we are going to be continuing the COVID leave up to 80 hours. So if the person cannot work from home, again, there is the possibility that you could work with your supervisor and potentially work from home. If that's not possible, then COVID leave might be an option if there is a quarantine of your child or if your child's school is closed due to COVID reasons. So you can reach out to Human Resources. The contact is Catherine Moore. She's our leave person, or you can send an email to hrassist@uark.edu.
Thank you. Mark, I know we have the vaccination incentives. What else is University Relations doing to really get the message out about vaccinations?
Yeah, definitely, we're working with student groups, especially Associated Student Government, graduate professional student Congress to help publicize and reinforce vaccination, the importance of it in many different ways. A lot of it's on social media. The incentive program is a part of that larger effort. And I think Bill, touched on some of that, but it's a pretty impressive list of incentives. From $500 scholarships, there are 45 of those. There are $100 parking permit credits, there are 250 of those, and it just keeps going down the line, backpacking trip to the Grand Canyon, et cetera, et cetera. There's some nice incentives in there. And one of the things that we worked with in students when we talked to the student leaders was that originally we had planned to incentivize only the unvaccinated to get vaccinated, because obviously that's our primary goal. But that didn't seem fair to all the students that are already vaccinated. And we don't want to, we want to encourage that as well. And so the incentive program, we actually changed and evolved the incentive program to focus on the incentive is now, if you're unvaccinated, get vaccinated and you can be a part of these incentives. And every day and every week you delay your vaccination, you're delaying another weekly drawing and the opportunity to win so many of these great incentives. And so that's a big focus of ours. And I'll just take a second to remind folks that if you haven't bookmarked our COVID-19 response site by now, that's a good idea. We've updated that continuously for the last 18 months that it's been around. If you don't know where it is or ever forget, it's easy to go to our university homepage, uark.edu, and there's a link right under the big photo at the top of our homepage. And that site has a lot of resources, including our campus guidance on a number of topics. There are 10 different sections, from vaccination information, testing, quarantine, isolation, to other things like class attendance. So we found that over the past 18 months, a lot of the questions that come up over and over again are actually answered there if folks know how to get there. That site also has the self-reporting form that Melissa talked about. If you ever test positive, you've got to self-report. That form is there. It has the link to the COVID-19 dashboard, so you can get an idea of the status of COVID on campus. We began last week to return to reporting that data and updating that data 3 times a week. So that's there. And then, of course, the link to the vaccination incentive page is there as well for students. I think that's a little overview.
Thank you. Yes.
In response to Terry's response to Steve LaCrae's question.
Yeah, I expected this.
Well, Terry, you made it sound like if a student's going to take your class remotely for whatever reason, that they need to contact you in writing. Well, according to Dave McNabb is the chair of biological sciences. He came up with a a plan that was approved by the administration. I'm going to read part of this to you. An alternative strategy is to provide your course both remote and face-to-face to all students in the class. And let the students know that that you will be in the class lecturing face-to-face at the designated time, and they are free to attend the face-to-face lecture or view the lecture remotely, whichever is more comfortable for them, given the circumstances. Now, this is how my class is set up right now, totally hybrid, without any requirement for them to tell me that they're going to be doing remotely.
Yeah, last I saw David's thing, there was a statement in there that you were to get a email confirmation from the student. He and I talked about that, and there was something in there about having some written request from the student.
Well, that's number 2 here. And number 4 says this is an alternative strategy, which does not require.
Okay, you gotta teach from your classroom no matter what.
That's
given. You can, your attendance policy, if you choose, whatever you choose on your attendance policy, you can allow the student to not attend the face-to-face class. And however you provide that, whether it's a recording or a live synchronous, you can. But what we have asked for is that you get an email from that student requesting to not attend a face-to-face class, and you're responding to their request. We do not want the fact that say that you got to attend remotely. You do not have to, students do not have to, and we want them to request from you that ability to not attend the face-to-face lecture.
History lesson. When we had this issue last year, there were students who informed parents that there were courses that had gone remote that actually hadn't gone remote. The student simply wanted to attend the class remote and had the power to do so. And so we deal with the challenge of being able to assure parents that that course isn't remote, that it is actually face-to-face. And one way that we can verify that that student is making this decision is through a direct request from that student. So that's why we really need for people to go through that step, because it helps us to be able to correct a misperception of what we really are. And what we are, we're providing a face-to-face opportunity. If the student decides and the faculty agrees to the request, then that's the student's decision, not the faculty's decision. So that's why, again, I know it's a step that maybe some people might find cumbersome, but it's helpful in dealing with, some contradictions of how this some debate about how all of this came into being. We get accused very quickly of being, going remote. Faculty members took their classes remote. And we need to be able to assure people that that's not the case.
So what you're saying is that I should put in my syllabus that if they plan on taking the class remotely on any given day, for whatever reason, because that's what this says, that's what this says.
No. I think this is a condition of attendance. So, it's if there's a given day, that to me is different than a plan for the duration of the semester. If a person decides they put in a request to attend it remotely for a day, that's not the same thing as a plan for the entirety of the semester. I mean, I want this to be practical. I'm not expecting faculty members to require a direct request for a given day, but I do think it's important for a plan for the semester. If a student intends to spend a considerable portion of that class in a remote, to take it remotely, then we need to have some documentation for that.
Then I will add that to my syllabus.
Kim, how many students in your class?
But it's small this semester, only 253.
That's
It's usually 450.
We have to give you something else to do, Tim.
I know. All this free time, Charles.
You're gonna be sorting emails all semester.
That's right. Question, yes.
But if a student requests to take my class remotely, why do they not have to go through CEA accommodations? Is it just, if they just, I just want to sit in my pajamas and take your class?
And you can say no. I mean, you have that power. They don't have a right to a remote ability to take a class remote. That is let's make that very clear. The faculty member can say no. You must attend that class in the traditional face-to-face mode. We don't want you to require students who are sick to require.
Right.
You know,
They
but
have some-
you don't have to, no, they don't have a right to a remote attendance. The faculty member controls that decision. And I think that's really important to understand. That's the difference between this year and last year. We gave the students the right to choose to be remote last year. We're saying you don't have that right. The faculty member decides that now.
Amen.
Yes.
The only thing is if they're requesting it as an accommodation for disability, then yeah, you would go down that path.
That's a different.
That's a different situation.
Okay, thank you.
Well, here and then we'll come back over here. Yes.
Are we gonna come up with a list of reasons that students, when they send an email to faculty asking for remote access or not attending the class, are we gonna put a list of reasons, or is it just gonna be at the faculty's discretion?
It's the faculty's discretion. Look, unless it's CEA accommodation, you have total discretion. You can say absolutely not, you must attend this class. That is your authority. And feel free to utilize it. Yes, sir.
Now, I'm going to show up routinely to 0205 South Engineering and lecture my heart out.
Yes.
However, this is hearsay and you can reject it or not. I've already heard faculty say, we worked very hard to record our lecture last semester for asynchronous attendance, and we're not going to lecture. How are you going to police that?
I'm gonna leave that to Terry. Terry, would you?
I mean, there are hundreds of faculty.
I understand.
2 or 3 of you people sitting in your offices safely.
Wait, whoa. No. That is not the way this is going to work. You will see me out on campus meeting. I've already started meeting with student groups on campus in classes. So no, I don't want you to have a misperception that I'll be sitting safely tucked away in my office.
Misconceptions, don't worry.
And I'm just trying to clear the record. I intend to be with the faculty out on the campus, engaging the student body in many arenas. So I just want that to be clear. The administration is going to be right there with you, not sitting on the sidelines giving orders about how you need to do it. Go ahead, Terry. Talk about policing.
If I'm understanding your question, Warren, what would we do if a faculty member chooses not to come to class to lecture, but just posts a recording? I would expect the supervisor or that faculty member to deal with it. Because we are a face-to-face, we're delivering back this semester. We are in this classroom face-to-face.
I'm too chicken to do that, don't worry. But I have already had face-to-face conversations with people that I'm not gonna do that, and the chairman has given me a way not to do that.
We're to be here lecturing in the class every day. And any student that wants to attend that class can come to this classroom and attend that lecture. And I can assure you, if that doesn't occur, there will be phone calls coming to our office, your department, your college. There will be lots of complaints about that. And so, but the faculty are expected to be in the classroom delivering the lecture.
There's a question about the Come As You Arkansas event. Mark, have there been discussions about scaling down or postponing?
Well, Come As You Arkansas is a part of the larger sesquicentennial celebration. The university's really kind of extended it through 2021 into the spring semester of 2022 as well, just because of COVID. It was harder to do some things early in 2021, but the Come As You Arkansas event is scheduled for Friday, September 10th. That's the night before the Texas game. It is primarily an outdoor event. A lot of the activities are outdoors across campus, the lawn of Old Main and throughout campus. There are some indoor activities. Most of those are quick, sort of open houses, tours, art shows, brief presentations, things that folks that obviously are masked indoors when at least 6 feet of social distancing can't be maintained. And so not really scaling anything back. The only event that I can think of that's probably longer than say 15, 20 minutes is a planned film showing, I believe, that may be closer to an hour or so. That's the only one. So primarily an outdoor activity. The public is invited. This isn't a campus event. Obviously, the university is going to be continuing classes and other activities that day. This is an event where that all of the public are alumni, interested folks in the community throughout the state, prospective students, anyone who's interested is invited to come and learn about what the university is and what we do, what our purpose is. So a lot of the colleges and departments have set up activities to sort of showcase what they do and why, let people know who we are, what we do, and why it matters.
Thank you. Yeah, go.
I'm a graduate student here. I just transferred from undergrad at Oklahoma State. This is one of my questions on the same topic here. As a new student on campus here, what are kind of more activities and ways to get involved, as well as to make connections on campus? So I know I signed up for Hill Fest and Razor Bash as well, just the first week of school. What are some other volunteer or student-oriented groups that I could get involved with, kind of thing, as well as for the other new students as well?
Well, pass that to Melissa. Go ahead.
I'm so glad you asked that question. This week and next week will be full of activities where you can connect with student groups on campus. The UREC has outdoor activities and bicycle tours. That Hillfest and Razor Bash are excellent activities to learn about what's going on in the community and also on our campus. A lot of people doing tabling. I encourage you to reach out to the Graduate and Professional Student Congress about opportunities that they have for graduate students. In addition, we have, if you're interested in volunteering, please go to the Center for Community Engagement. And if you want to check with me before you leave, I can give you an even more direct way to reach out to that group, because it is a very robust volunteer operation where you can find a variety of ways to get involved in volunteer services. So let's visit before you leave.
Terry, questions come in about faculty and using remote or asynchronous lectures. If a faculty member has to travel or if a faculty member becomes ill, can that faculty member use asynchronous lecture delivery as an option?
I would say, this has come up a time or two. Just before the pandemic, we had faculty that needed to travel. Sometimes the faculty even then would record a lecture or would have somebody else lecture for them while they were away. And I would say that you would need to talk to your supervisor to see what's the best for your situation. It may be that a remote or a recorded lecture is appropriate for 1 or 2 lectures for a short-term environment situation, but I would say talk to your supervisor, your department chair, how they would like for you to handle your absence while you're away from the class.
Huda, outdoor events where we don't require the mask, but there's significant level of density. Could you talk about recommendations that we have for those types of events?
Sure. Outdoor events in general, obviously, are safer than indoor events. But again, the rule still stands. If you're in an outdoor situation where you're in crowds and you're not able to physically distance from other people by at least 6 feet, you need to be wearing that mask. Case in point, farmer's market in Fayetteville this Saturday. It's pretty crowded on the square. The sidewalks get pretty crowded. I mean, it's outdoors, but you can't really physically distance from everyone by 6 or more feet. You need to be wearing your mask, and that will protect you and also protect those around you. So again, the mask does a lot. It is a small thing, but boy, it offers the frontline protection. It's the first frontline protection to those around you and to yourself.
Aaron?
As a member of Staff Senate, we sometimes get asked questions about what flexibility exists for staff. Maybe if they're in roles where they meet one-on-one with students, or if they work in a densely populated area, office area, where they have to do manual labor. So can you talk a little bit about staff options?
Yeah, I think I can take that one. Again, the answer is kind of the same. They need to work with their supervisor. I know I've gotten calls about areas where they can't socially distance, and a lot of times when I look into it, I think, as far as the measurement goes, that the office is under the impression that they can. But again, if they're uncomfortable, I would work with their supervisor, see if there's other arrangements or short-term arrangements that may work for them. So I would work through that supervisory chain. If the person feels like that they're not getting the information or the solution that they're after, then I would encourage them to reach out to their departmental HR person or to Central Human Resources, and we can certainly advocate or see what we can do to assist them with their concern.
We have about 7 minutes, and so I just want to open the floor for any more questions as we wrap up this Q&A. Yes.
Earlier, you mentioned reassessing the mask mandates as things move along in the semester. Do we have benchmarks set for what kinds of things we're looking for in terms of community transmission or vaccination, in terms of what would get rid of that?
And currently, we do not have those benchmarks, but we'll be thinking through and working through some, ideas about how we can best make those decisions moving forward. I would love to be in a place where, realistically, we could think of maybe taking away the mask mandate inside of our buildings. Of course, if the court issue involving Act 102 changes, then we could find ourselves being unable to require the mask in the buildings. But as of today, we don't have those metrics relative to how we would make those decisions, but we will be thinking through how to do that and where, and of course, working with Huda and her team to determine where we might pivot away from a mask mandate. But at this time, we just think that's not the conversation we need to be having. We need to socialize people to wearing the mask inside buildings to keep everyone safe. So, yes.
Can I just add one thing? Yeah, sure. One of the things that informed the board's decision to require masking on campuses was the CDC guidance pertaining to indoor wearing of masks in areas that are hotspots for the Delta variant. And so, that is, I would imagine that is one kind of thing that we would continue to look at is CDC guidance and pertaining to hotspots and what they recommend and that type of thing. It's not to say that would be the only thing, but that is certainly one of the considerations that led the board to implement the requirements for all the campuses that they did. So,
Thank you.
So Chancellor, I want to confirm the way that like some people bring in guest speakers to campus to lecture their classes and stuff. Are we basically open? Do we need to register those visitors like we did last year? How are we treating visitors and things like that at campus?
I think the plan is for us to have a registration. I've seen the form for that. And so we'll need to make sure we get that information distributed. Kurt, you probably could talk a little bit about that.
Still working in the process of it, so give us a little bit. We want to attract visitors, we want to know who's on our campus.
That's right. Thank you. Any other questions with our 4 minutes left from the audience? I can't believe it. And we're at an institution of higher learning with faculty in the room. There are no more questions. I'm going away. I do have a question though that came in. What about the N95 or the KN95 masks? Are there any plans to purchase those for faculty who might request them? Or staff who might request them?
I'll do that one. So there is a difference between an N95 and a KN95. An N95 is considered a respirator. And if you have a respirator, you have to have a respiratory protection program. So as an employer, we cannot furnish N95 masks. KN95s are available to the public. I will also say, if you as an individual choose to wear an N95, certainly that's your prerogative to do so. But as the employer, we can't furnish those. On the KN95s, I think the efficacy would suggest that if we wear what we have on us, and if our folks that we're facing wear those, there's not that much of an advantage to go to a KN95 unless you have some specific health condition that might suggest it. So,
I just also want to underscore to those who feel like they're in a space that doesn't allow for, and for staff, particularly in a space where there's not a lot of social distancing, to talk with supervisors to see how we might tease out some opportunities in spaces so that people can have a bit more social distancing and feel more comfortable. I know the masks help a lot, but still, if there are spaces where we feel a bit packed tightly, there are usually things that we can do to help that situation feel a little safer for people. And I just want to say, just again, in closing, I'm excited about this semester. I really appreciate each and every one of you and the work you do to help facilitate the educational process on this campus. It doesn't work without our entire team. And so thank you for everything that you're doing. I know we'll continue to have these conversations, and I know you'll let me know you think that things need to change. And so I appreciate that and value that. And so go out and have a great rest of the day, and let's look forward to a wonderful semester. Thank you so much.